Dan and Amy, although Amy's not here, she's on an ICE detainer back to Stockholm, so we'll see if she makes it out in time for tomorrow. But the recriminations continue with respect to the failure to move Obamacare replacement out of the House last week. The Wall Street Journal has gone from terming the Freedom Caucus the Freedom from Reality Caucus to today in another editorial calling the Freedom Caucus the GOP's Entitlement Caucus because, per the Wall Street Journal's opinion, they missed an opportunity to roll back an entitlement that doesn't come around very often at the federal level. That's the argument they make, particularly as it pertains to block granting Medicaid to the states. Trump has moved on, sort of. He's still sending shots across the bow. The Freedom Caucus tweeting last night, the Republican House Freedom Caucus was able to snatch defeat from the jaws of victory. After so many bad years, they were ready for a win. And when you have Byron York pen a piece that says that's entitled 14 Lessons from the GOP Obamacare debacle, 14 lessons from the GOP Obamacare debacle, that's a lot of lessons. That means a lot of things could have gone better. For more of what could have gone better and why members of the Freedom Caucus should have embraced this, as well as a response to some of the demands that were put forward by the Freedom Caucus and not met, at least not met sufficiently. We're pleased to be joined by an expert in this area. He is the founder of healthinsurancementors.com and has been a health insurance broker for many, many moons, and really has established himself as a national expert on health insurance policy through his analysis of Obamacare over the last 7 years and now what Republicans had proposed as a replacement. He is C.Steven Tucker, and he joins us now. C.Steven Tucker, thanks for joining us. Appreciate it.
Good morning, Dan.
So you posted on your blog, you posted what parts of the American Health Care Act did conservatives disagree with, and you went down 13 component parts of what was proposed and not voted on in terms of things that conservatives should like about Obamacare replacement that apparently not enough did. What are, give us the thrust of the argument you make.
Well, you correctly mentioned one already, and that was repealing an entitlement, which is the first time that's been done in U.S. history. And that was repealing the Obamacare subsidies, which was remarkable. We've never done that before. But that's not the only issue. We had a chance to provide tremendously needed relief for people, repealing the individual mandate. I mean, how many people in this country have been complaining for the last 7 years that they don't want to be taxed for not buying something? That was our primary issue when we went to the Supreme Court. Unfortunately, we lost on that. This bill would have repealed the individual mandate. Moreover, it would have repealed the employer mandate, so we can now become once again a full-time nation instead of a part-time nation. As you know, employers are afraid to provide anything more than 30 hours because they'll have to be forced to provide very expensive Obamacare health insurance. Block granting Medicaid to the states and putting per capita caps on. Do you know how long conservatives have been pushing to have that done? Because, as you know, we have a $3.8 billion deficit here in Illinois, and we've got $10 billion in unpaid bills coming by December. So it's because the way Medicaid is set up now, every dollar the state spends, the federal government matches. So it provides an impetus for the state to spend more, right? So we've been asking for that for years. In addition to doing all of those things just in phase one, by the way, not ever getting to phase two or phase three, just if we got phase one done. All of that is including cutting spending by $1.2 trillion, reducing the deficit, repealing $600 billion in Obamacare taxes, and then most importantly, a feature that would immediately lower premiums for most Americans, and that is recreating high-risk health insurance pools. This is the way risk in the individual health insurance market was managed for 20 years before Obamacare. You simply remove the 5% of people in the individual market that are responsible for 50% of the cost, the sickest people, and you place them into state-run high-risk health insurance pools, just like we had for 20 years here in Illinois called iChip. They get the Blue Cross card. They have the same access to all the same hospitals and doctors. But by removing those people, You then lower premiums for everybody else. And most importantly, we could have done that and spent $30 billion less a year than we currently are now subsidizing that sick population.
Yeah, but
all of that could have been done.
But see, here's the thing. The rub, it seems to me, from the Freedom Caucus was that the proposal did not reduce premiums fast enough because Jim Jordan was one, a congressman from Ohio, argued that, per the CBO's scoring, premiums may continue to rise in the short term, and over the course of the next 7 to 8 years, they decline. I mean, according to, again, CBO projections, which I don't know how much we should take those as gospel, but would decline by kind of on average 10% over the course of 7 or 8 years. But we wouldn't see the immediate reductions in premium costs at present, and that seemed to be the main sticking point of the Freedom Caucus. What do you say to that argument?
If Jim Jordan doesn't know enough to ignore everything the CBO says on healthcare policy, I can't help the man. They have been wrong on everything pertaining to healthcare policy.
So you believe that people would have seen, on balance, again, if you pool those high-risk individuals, you think most people would have seen a near immediate reduction in their premiums?
Of course they would. In addition to that, we would be re-incentivizing young people to re-enter the health insurance market. Community rating failed in 12 states before it became federal law, where you charge older people 3 times more, maximum 3 times more than what you charge younger people, meaning that the base price for younger people is exponentially higher because you can only charge older people 3 times more. Going back to a 5-to-1 ratio means that the base premium on young people will be much smaller because older people can be charged up to 5 times more. So it would lower premiums immediately for younger people. We have to re-incentivize younger people to get back into the marketplace. We need them because they don't have claims actuarially and statistically for years. But all of that doesn't matter, because if we don't get the individual health insurance marketplace back into a place where people have options, we have lost, Dan, and no one's reporting on this, 37 health insurance carriers in the last 3 years. 37 carriers, 19 carriers that existed before Obamacare, and 18 Obamacare co-op created health insurance carriers. Something is wrong. And if we don't fix it, my clients who cannot go to see Northwestern, University of Chicago, Rush, the Anna Robert Lorry Children's Hospital, the people who are sick, they're not going to have options. We're already down to 1 carrier in 1/3 of counties in this country. We have only 3 small carriers left in this state, and they're offering HMOs only. Something has to be done now. People need relief. The busiest day I had in my 21-year career was the day Obamacare was passed, and people were calling to find out more about it. The second busiest day was yesterday, when my clients realized that after we control the House, the Senate, we have a president controlling the executive branch, we couldn't provide any relief for 7 years. We've been like Oliver Twist. More, please. Can I have more, please? When they repeal a little tiny bit of Obamacare, begging for more scraps from the table. Now we can repeal the worst parts of Obamacare. And what does the Freedom Caucus do? They say no after we gave them over and over concessions. They asked for block grants, including per capita. They got it. They asked for able-bodied Medicaid recipients to have a work requirement, at least be looking for work. They got it, right? They got all of these concessions. And when they had a chance to lead, instead of being the party of no, which they rightfully were during Obama's administration, now's the time to lead. They said no. And now we suffer until 2019 because we can't use the budget reconciliation process until next year. We had until the end of May. It's over now, and because of them, we all will now suffer for another at least year and a half under Obamacare.
And what do you project that suffering will look like? Because you've had President Trump and others suggest the obvious. You're just describing some of the evidence in support of the idea that Obamacare is imploding, that it's going to continue to get worse. Premiums are going to continue to spike as they did coming into this year. A choice is going to continue to be more restricted and at the whimsy of the government. And so people's access to quality care will essentially worsen at higher prices. That's the argument that's being made. So what is this? What do you see in kind of the near term, the next year to year and a half, for health insurance in this country.
That's a very valid argument. Understand, Healthcare Service Corporation, which owns our own Blue Cross Blue Shield of Illinois here in Illinois, they lost $1.5 billion, not million, billion with a B, last year alone. We're not even talking about the hundreds of millions of dollars they lost the first 2 years into Obamacare. So when they lose these kinds of amounts of money, all they do is restrict choices to the consumer. That's why you can't go to Northwestern, University of Chicago, or Rush. And that's why you have only HMOs. And that's what we're going to see as we go forward. Fewer carriers, a larger monopoly than we already have, and the only people that will suffer will be the American people.
And do you see, and we're going to talk to somebody in this practice, do you see a movement for those who are able to concierge care, to walking away from the government, walking away from health insurance companies, out-of-pocket payments to providers, cutting out all the middlemen?
Absolutely. I already see people going to these Christian sharing programs, which work, as long as you stay healthy, but they're not regulated, so there's no financial reserves there. So if you have too many people have too many claims at one time, you're in trouble, as they were in 2012 when Medicare was shut down by a federal judge in Kentucky. There's very great risk to doing these alternative things, but I don't blame people because, Dan, when you can't get a subsidy to lower premiums, which is the vast majority of my clientele, do you know what they're paying for health insurance? It's more than double their mortgage. That's where we're at. The situation is crucial, and it's no longer about ideology. It's about providing for relief, for God's sakes, to the American people we've been begging for 7 years.
It seems to me, I don't know what your experience is with your clients, but it seems to me that a lot of people, frankly, are, to your point about ideology, non-ideological about healthcare policy, and they get pushed one direction or another by Rand Paul screaming about a new entitlement being the tax credits, or the left screaming about this being a tax cut for insurance companies and the rich, and all of the important issues about health insurance as a means to quality, affordable, reliable care are kind of lost in the political demagoguery coming from both directions.
Yeah, and it really is. It's something that has to be taken seriously at all times. As you said, it's about people's life and death. My brother is dealing with cancer right now and lost access to Rush University Medical Center. I had a client who called me during the open enrollment period, a woman with advanced ovarian cancer. She called me from her hospital bed at Northwestern Memorial Hospital. She was in tears because she was being informed she has to leave the hospital as of January 1st because Blue Cross no longer provides access to that hospital in the individual marketplace. This isn't a game. And I don't care what Rand Paul or anybody else says. I deal with this every single day. And the demagoguery and the lies, Rand Paul out there saying that the tax credit is a new entitlement. A tax credit, if a tax credit is a new entitlement, so is a child tax credit. It just means you keep more of your own money so you can spend it on health insurance. He was demagoguing all of these things that are inside the bill when many of those things were in his repeal bill, including the tax credits. So you have to get beyond the talking heads and actually just take the time to read the bill. It took me 90 minutes, Dan. I was on the air with you the following morning. Stop listening to the talking heads, most of which never read the bill, and just go read the thing.
All right. He is C.Steven Tucker. He is the founder and principal broker for healthinsurancementors.com. CS, thanks for joining us as always. Appreciate it.
Thanks, Dan.
And he joined us on the turnkey.pro answer line.